They did reach an agreement on managed care. It's still going to happen. That may be why Kevin Stitt's still going to veto the budget. I'm not sure. Um, but basically, I believe what it comes down to is they're just going to put some guardrails on Stitt's plan, like whatever the heck that means.
A little bit
And
less grift.
yeah, right. I mean, so it's like probably. I mean, these bills get announced so late they can't even tell you what it's about. But basically, the fight came down to the state wanted to keep letting the healthcare authority manage it. We do a good job. People are happy with it. It's probably lower cost to do it via state management. So, but instead, we're going to insert a private entity in the middle and enrich some huge out-of-state company. So cool. Hopefully this law has something in here that if they suck, we'll rip it back from them and cancel their contract and send them packing. The hilarious thing could be is that if the guardrails are too strict, these companies may not even take it. So
We especially need guardrails on the one that's currently being fucking investigated for embezzling money. We should probably keep some guardrails around it. But
I mean, private insurance is such a scam. I mean, there's just no way you can take it. And then you're going to take private insurance and put it over the people who can least afford it and wonder who they're going to go after. I mean, it's just like, it's so grotesque. And
so often a great Minkin quote is that for every complex problem, there's a solution that's plain simple and wrong. This isn't one of those cases. I can break down managed care for you in a simple phrase: somebody getting fucked. We just got to figure out who. That is what managed care is. We need that managed care or nothing but maggots on the fucking carcass that is American healthcare, figuring out where they can find more money, right? And so what they're going to do is try to find a way to either squeeze patients, squeeze providers, or squeeze both. But somebody's getting squeezed, somebody's getting fucked. That is what managed care is. So thank you for coming to my TED Talk.
yeah. And Medicaid's already probably the best program America has for controlling costs because they pre-negotiate lots of stuff and they have fixed rates for reimbursement. So it puts it back on the provider. It's maybe a little harder for them to make grotesque profits that many people in healthcare manage to make, but it creates a very fair marketplace because you're guaranteed to get whatever you get for certain services. So you're able to build your practice accordingly and construct things. So, Medicaid becomes a little bit more of a volume business. I don't know. My experience with it's been, I think it works pretty well, but now we're going to introduce private company in the middle that's seeking to make a profit for themselves. And yeah, I mean, they're going to squeeze one of the two sides. And unfortunately, even Republicans in the legislature believe it's going to be patients that get squeezed. And these are our most vulnerable people: foster children, low-income kids, working poor who can't get jobs that give benefits or pay. I mean, it's just gross. It's extremely gross.
The fuck them kids legislature.
Absolutely.
And I was a poor kid, and I tell this story. I was a poor kid who received senior care. And it's funny because I went to the dentist last week and I had to fucking pay them almost $300 for substantially less dental work. When I had Sooner Care, I went to the dentist. One thing I tell people all the time, backing it up a little bit, one thing I tell people all the time, what I remember most about growing up poor in rural Oklahoma is the toothaches, like teeth down there. I like people down there, a lot of them haven't been to the dentist in years, and it's toothaches, it's teeth. Like that's a weird thing, but that's what I remember most about that is the toothaches. But I missed a lot of school, all of that jazz. I ran into a dentist. I was fortunate to come in contact with a dentist, and he told me it was that point was August 2008, and my Sooner Care would run out when I turned 19 on December 1st, 2008. And this is what he told me: if you can get to my office every week with your Medicaid, you will literally get thousands of dollars of dental care for free. And I went to that dentist's office and we pushed it up to the end. I think like Thanksgiving break, I was like loopy as shit. Going back to Hugo. But I haven't had a toothache since then. My college attendance rate is higher than my high school attendance rate because I had no toothaches. My grades in college are higher than my grades in high school because I didn't have any toothaches. Like when I say, I cannot sit here and tell you without that dentist, without Medicaid, I would be where I am today. So when I say like Medicaid is a program that we need to invest in, we need to make sure that it has all of the resources it needs. We need to not fuck patients. I mean that with every fiber of my being, because it's one of those things that had a real impact on the trajectory of my life. And I thought that's what the fuck we're all doing here, right? Like we want kids and people to have opportunities. Well, clearly they don't, but that's what we're supposed to do for anybody.
Yeah, and the Frontier had a good article out. I mean, just talking about, so you've got toothache. Some people have mental health challenges, and like the companies, I guess, that are proposing to take over the Medicaid system have in other places began cutting mental health services, which again, Oklahoma's already aren't.
I'm saying I don't know what they're gonna cut. I don't that just requires. I don't know if they'll do it because like cutting anything else requires some real innovation. Like you gotta search for like, yo, what else? You gotta really look for some more shit to cut here.
Yeah. So I mean, it's just reducing inpatient treatment for children in foster care is part of one insurer's plan. I mean, it's just like, I mean, why? Like, what problem is that going to solve except to save like some tiny fraction of money and not give people
children, foster children, right? Yeah. They're people obviously, but you're taking mental health away from foster children. Like, cool. That's fine.
Gotta keep that on the bottom line, I guess. Yeah. I mean, so anyway, and these are just the early things before we've even gotten it out there. So I'll be interested to read this legislation that supposedly puts guardrails on this stuff. Hopefully it's a 3 to 5 year mistake and not a 10 to 20 year mistake, but because Oklahoma tried managed care before and it failed, so we did it and then had to undo it. So very cool.